Within the efferent division of the nervous system, the major neurotransmitters are acetylcholine, epinephrine, as well as norepinephrine. And cholinergic receptors are those that bind to the neurotransmitter acetylcholine, whereas adrenergic receptors are those that bind to the norepinephrine as well as epinephrine. Now, we're gonna first look at how these receptors are classified based on their actions, the major classes of these receptors, and then we'll look at where in the motor system each one can be found and the effect that each one brings about on the target organ. So neurotransmitters and the receptors in the efferent division. So this looks like a complicated chart, but I encourage you to draw this out in a simplified form to help yourself remember where you can find each type of neurotransmitter, as well as where you can find each type of receptor. Okay, so ACH stands for acetylcholine, E stands for epinephrine, NE is norepinephrine. Okay, and let's first take a look at focus on just the neurotransmitters. So we'll see that, as we mentioned, with the neuromuscular junction, right, we have somatic motor neuron releasing acetylcholine onto the skeletal muscle fiber. Okay, so that's acetylcholine. Within the autonomic nervous system, the neurotransmitter that's released by the preganglionic neuron, whether it's parasympathetic or sympathetic motor neuron, we see that in both divisions, the preganglionic neuron will release acetylcholine as well. So acetylcholine, acetylcholine, acetylcholine. Okay. And then within the autonomic nervous system, the parasympathetic division also has postganglionic neurons that release acetylcholine. Okay. So that means within parasympathetic division, both the preganglionic as well as the postganglionic neuron, both of them will release acetylcholine. Okay. And then with the autonomic nervous system, the sympathetic division will have postganglionic neurons that release epinephrine or norepinephrine. Okay, mostly norepinephrine, with the exception of adrenal medulla, where epinephrine is the predominant neurotransmitter and neurohormone that's released. Something we'll discuss later in this lecture. Now, let's take a look at the receptors. So, in terms of cholinergic receptors, or receptors that bind to acetylcholine, we have two major classes. There are the nicotinic cholinergic receptors. We also have the muscarinic cholinergic receptors. And in the next few slides, we'll discuss more about what they are, but we're just looking at their locations right now. So nicotinic versus muscarinic. So nicotinic receptors can be found on the skeletal muscle fibers. Okay, so within neuromuscular junction, we will find nicotinic cholinergic receptors. We also find them on the cell body of these postganglionic neurons within the autonomic nervous system. Okay, so that means the preganglionic neurons are going to release acetylcholine that bind to nicotinic cholinergic receptors, whether it's within sympathetic or parasympathetic nervous system. The story changes a little bit when we're looking at what happens with this postganglionic parasympathetic neuron synapsing onto its target organ. So here we see that the neurotransmitter that's released, again, it's acetylcholine, but it's going to bind to muscarinic cholinergic receptors on its target organ as opposed to nicotinic. Okay, and then within the sympathetic division, since the postganglionic neurons are going to secrete catecholamines, namely epinephrine and norepinephrine, so their corresponding receptors are going to be the adrenergic receptors. And adrenergic receptors come in a wide range of flavors, anything from alpha 1, alpha 2, beta 1, beta 2, beta 3, something we'll take a closer look at in the next few slides. Okay, so take a look at this and pause the video and try to draw a simplified version of this to familiarize yourself with regards to where you can find each type of neurotransmitter and their receptors. This is a review slide of a previous lecture, going over the concept that function of a neurotransmitter is largely determined by the receptor to which it binds. Okay, and we can classify these receptors by their action. Okay, and one class is inotropic receptors, which are direct action receptors. These are receptors that are also ion channels at the same time, and the ligand or neurotransmitter binding to the receptor causes it to open and for ion to pass through it, thereby altering the membrane potential. So this type of receptor channel tends to bring about a very rapid action. This is in contrast to the indirect action or metabotropic receptors, which carries out events through the G protein pathway. Okay, remember the G protein transduction pathway. So if you don't remember that, remember to review that. So this type of action tends to be longer lasting, but bring about a more widespread, broader effect. If you recall from the G protein pathway, right, within each of those steps, amplification occurs, right? Whether it's from the ligand binding and activating GPCR activating G protein, then activating adenylyl cyclase, that then turning ATP into cyclic AMP. Cyclic AMP activates protein kinase A. Each of those steps there's another level of amplification. So this type of action tends to take longer to occur, but also have a much broader effect. So the neurotransmitter we call acetylcholine is one of the first to be identified and one of the best understood neurotransmitters. Its release is found in neuromuscular junctions, but also found within the autonomic nervous system, as we've seen. And its duration of effect is limited by an enzyme that degrades it within the synaptic cleft. It's called the acetylcholine esterase, sometimes known by the name of choline esterase, ACHE. So cholinergic receptors come in two major categories. Nicotinic receptors, or NACHR, which you've mentioned, are inotropic receptors. And there are subtypes within this class that I don't need you to know, but no nicotinic receptors can be found within the neuromuscular junction, as well as the specific receptors within autonomic nervous system, which we'll mention later. Okay, and the effect that acetylcholine has on nicotinic receptors are always stimulatory. Okay, muscarinic receptors, this flavor of cholinergic receptors, are a bit more variable, and they are, instead of being inotropic receptors, these are actually metabotropic receptors that carry out their actions through the GPCR pathway. Okay, so through affecting cyclic AMP gated ion channels. Their actions can be inhibitory or excitatory depending on the channel subtypes. Again, I don't need you to know the subtypes, but understand that its effect can be either inhibitory or excitatory. And the places we can find those are the the parasympathetic target organs. Okay, and there is illustration later that will help you remember where you can find each of these types of receptors. So this image is pretty much this image, but just without the somatic nervous system component. And I've included here to help you remember where you can find each type of neurotransmitter and where you can find each type of particular receptors. And try to practice drawing this out so that you understand the concepts. Once again, within the autonomic nervous system, we find acetylcholine in the autonomic ganglia secreted by the preganglionic neurons. Parasympathetic postganglionic neuron also secretes acetylcholine, but instead of binding to the nicotinic receptors, it binds to muscarinic cholinergic receptor. And also note that the sympathetic postganglionic neurons secrete norepinephrine. In the case of adrenal medulla, as we'll see, it actually secretes epinephrine predominantly. In either case, both epinephrine and norepinephrine bind to adrenergic receptors, namely the alpha 1, alpha 2, beta 1, beta 2, beta 3 receptors. This slide just recaps what we just talked about in Word format. So go over this. So this table reminds you that acetylcholine binds to these two classes of cholinergic receptor, nicotinic and muscarinic. Norepinephrine and epinephrine bind to adrenergic receptors, and these are the different types of adrenergic receptors. And it also includes information on where you can find each type of receptor. Looks like a confusing table, but we'll have a clearer table with details that I'll point out later that I want you to remember. So don't get bogged down by these details right now. Okay, I'll mention later the specific details that I need you to know. Okay, so adrenergic receptors. Okay, I've really simplified this table to point out a few key things that I need you to know right now. Beta 1, okay, you have one heart and two lungs, right? So it's pretty, it should be pretty straightforward to remember that because you have one heart, two lungs. So beta 1 is going to affect your heart mostly. Beta 2 affects mostly your lungs, especially the bronchioles. So the beta 1 effect on the heart, it increases heart rate as well as force of contraction. Beta 2, okay, and think about this because this is part of the sympathetic output. So to help you get through the crisis of being chased by a big bear, right? Your lungs are wanting to obtain more oxygen. So the effect of beta 2 receptor on target organ is going to be bronchodilation, dilation of airway to allow more oxygen to be taken up into your lungs. Okay, beta 3, don't worry about it. Alpha 1 mostly found within the peripheral blood vessels throughout your body, and not just any blood vessel in your body, mostly in the periphery, so serving the skin and mucosa, and the effect is vasoconstriction. Well, how do you remember that? Well, remember that when you are going through a crisis, right, there are a few organs that are considered critical to get you through the crisis. That, namely the brain, the skeletal muscle, the heart, okay? And so in those places, generally those places will have blood vessels that dilate to supply more oxygen to those critical organs. But because you only have so much blood in your body, right, you can't increase supply to all the organs. So for that reason, blood vessels supplying the considered non-essential, I shouldn't say non-essential, the less critical organs are going to constrict, so to ensure adequate perfusion to the vital organs, okay? And so the alpha 1 receptor are going to be found mostly in blood vessels serving those other organs. Okay, so vasoconstriction of these blood vessels ensure that adequate amount of blood gets shunted to the more critical organs. Okay, and then don't worry about alpha 2 right now. And this lower part of the table shows that epinephrine, norepinephrine have different binding affinity to each of these subtypes. And I don't need you to know which one it has higher affinity for, but know that generally they bind, both will bind to alpha and beta receptors. Okay, now the concept of ANS dual innervation. Almost all visceral organs are innervated by both sympathetic as well as parasympathetic nervous system. Okay, and there are a few key exceptions, including the peripheral blood vessels, sweat glands, adrenal medulla, liver, kidney, adipose tissue. In these places, these tissues only receive sympathetic innervation. Okay, and the other thing to note about ANS dual innervation is that, generally speaking, each division will cause an opposite effect in each organ. Okay, and so an example of that is in the effect of sympathetic and parasympathetic divisions on the pupil. Okay, so when you are in the dark trying to get away from that tiger that's been chasing you, it helps for your pupils to dilate to let in more light. So sympathetic division allows for pupillary dilation, whereas parasympathetic division allows for pupillary constriction. So the two have opposing effects. Okay, this is just stating the same thing. So another example is that sympathetic division increases the heart rate. It actually also increases the heart contraction, the force of contraction within the heart. Parasympathetic division decreases the heart rate, but it actually does not have an effect on the force of contraction. Okay, so only sympathetic division has an effect on increasing the force of contraction. The parasympathetic division doesn't have any effect on the force of contraction of the heart. It only works to reduce the heart rate. Okay, so both divisions are constantly in action. It's the matter of which one increases in activity, which one decreases activity. That changes over time and depending on the context. So here's a table full of details, and I will now point out the specific details that I need you to know. The effect of sympathetic division on the pupils is pupil dilation. Parasympathetic causes pupil constriction. Sympathetic effect on glands, most glands, is it decreases secretion. So think about when you're nervous, taking a test, your mouth feels dry, right? Whereas parasympathetic division stimulates secretory activity, so increases secretion, okay? And so you can consider secretion to be non-essential for getting you through crisis. So its activity is going to be reduced, okay, by sympathetic output. Sympathetic effect on heart muscle is increasing rate and force of contraction. Okay, parasympathetic effect is slowing the heart down. Okay, decreasing the heart rate. Okay, and as we mentioned, heart is considered a vital organ in crisis, getting you through crisis. So coronary blood vessels are actually going to dilate under sympathetic innervation and constrict under parasympathetic innervation. Okay, and we also mentioned how to get you through crisis, sympathetic division helps bronchodilation. Okay, parasympathetic causes bronchoconstriction. Okay, and since digestive and urinary activity are not essential to getting you through crisis, so they are going to be delayed until you are in a situation where you can relax, right? And so sympathetic activity are going to inhibit digestive function as well as urinary function, whereas parasympathetic are going to increase the activity of digestive organs and urinary organs. And then these, I've placed them together. As you'll see, parasympathetic effect are next to none or none for these organs. These are single innervation target organs, where these organs only receive primarily innervation from sympathetic division. So that includes, and when I say blood vessel, it's not just any blood vessel, because we already pointed out here that coronary blood vessel is an exception, but peripheral blood vessels, so most blood vessels that are less critical to getting you through the crisis. Okay? So these are going to constrict to ensure adequate perfusion to the heart, to the brain, etc. Okay. And sweat glands are its activity is increased by sympathetic output. Erector pili, okay, those smooth muscle that allow for goosebumps, okay, is also only under sympathetic stimulation. And then adrenal medulla, which we'll take a closer look at the end of today's lecture. Okay, under sympathetic innervation, it secretes epinephrine and norepinephrine. And then don't worry about these last two. Okay, so drugs that work on adrenergic receptors. These are very commonly used drugs, beta blockers, and there's a wide range of uses for it. These are going to block the effect of epinephrine and some norepinephrine as well, leading to reduced heart rate and force of contraction, which is the action due to beta-1 receptors. Okay, so beta blocker are going to block the effects from the beta-1 receptors. Okay, and so as you can imagine, it's going to be useful in treating hypertension. It's not usually the first line for treating hypertension, but it can be used for treating hypertension. Oftentimes, these are actually used for treating angina pectoris, myocardial infarction. I shouldn't say it's like it's not a medication that's used to cure people from heart attack, but it's one of those treatments that's administered to prevent another episode of heart attack, for example. Performance anxiety, because it alleviates those anxiety, physical symptoms that comes from anxiety. It doesn't actually do anything for the anxiety itself, but it takes away the physiological symptoms that's associated with anxiety. Okay, so pseudoephedrine and phenylephrine. These are agonists for alpha-1 receptors, okay, and within the nasal mucosa. And so when you have nasal congestion or even a bloody nose, you can actually use a nasal spray for these medications to help constrict those blood vessels and to alleviate the nasal congestion or to stop the bleed from in those nasal mucosa. Okay. So a sympathomimetic drug is one that produces physiological effects that's characteristic of the sympathetic nervous system by promoting the stimulation of the sympathetic nerves. Okay, so yeah. Okay, so adrenal medulla. Adrenal medulla is that special organ involved in your sympathetic nervous system. It consists of neuroendocrine tissue, because as we'll see, the neurotransmitters that are released also function as hormones. Okay, so those epinephrine and norepinephrine are neurotransmitters meaning they're released by nerve endings, but they're released into blood and travel through blood. So in that sense, they also are hormones. Okay, so they're neurohormones. And so for that reason, adrenal medulla is considered neuroendocrine tissue. Okay. So the primary neurohormone secreted is epinephrine. Okay, so recall that the preganglionic sympathetic neuron have its cell body located within the lateral horn of your spinal cord. It extends out, and in this case, it sends its axon into the adrenal medulla. Okay, and then this is, as we've learned, where the acetylcholine is released. Okay, and then on the membrane of that postganglionic neuron, okay, we will find nicotinic cholinergic receptors, right? And these specific postganglionic sympathetic neurons have another name called the chromatin cell. Okay, and so the chromatin cell is seen as a modified postganglionic sympathetic neuron because they don't have that long axon that's normally seen in other parts of the sympathetic division. Okay, and what we see is that these chromatin cells, upon stimulation, will release epinephrine. Excuse me. Will release epinephrine into the bloodstream. Okay, epinephrine, because it's released by these modified neuron cells, so they are neurotransmitters, but because they are released into the blood, they're also considered hormones, hence neurohormones. Okay, so a quick summary of what we learned today. Okay. Anatomical differences between sympathetic and parasympathetic divisions. We've also looked at anatomical differences between somatic motor system and autonomic nervous system. So review those. We looked at the functional difference between the two, as well as the receptors and the neurotransmitters found in each. Okay, so look over this table to make sure you understand the concepts. And this is a summary illustration showing that somatic motor system. We see the single neuron releasing acetylcholine onto the skeletal muscle fiber, and the receptor on that skeletal muscle fiber are nicotinic cholinergic receptors. And such is the case for autonomic ganglia as well. Okay, we see acetylcholine binding nicotinic receptors. Okay, we find that in adrenal medulla as well. Okay, and then in parasympathetic postganglionic neurons, those release acetylcholine, but those acetylcholine then bind to muscarinic cholinergic receptors. And then within the sympathetic division, the postganglionic neurons within the sympathetic division secrete norepinephrine mostly, and epinephrine in the case of adrenal medulla. And then the target organ will bind to those with its adrenergic receptors, whether that's alpha 1, alpha 2, beta 1, beta 2, beta 3. Okay. And that concludes our lecture.